Hello everyone. Firstly, I would like to thank Bronwyn Campbell and Rhett Emery for giving me the opportunity to give this address today. Secondly, I would like to thank all of you for attending an early Sunday morning slot. I feel very privileged to have been offered a stage on which to share my journey into medicine and in particular into general practice, and to share my feelings and ideas about ongoing education in the future. I was born and raised in a small town on the northwest coast of Wellington. I was educated first at the local primary school and later Wellington College. After leaving secondary school, I headed south to Dunedin, and between footy games and trips to St Clair and Wanaka, I completed my MBCHB at the University of Otago. As mentioned, I began in general practice in 2009 in Mount Maunganui, and I completed Primex last year and am currently a GPEP2 registrar. Currently employed at Waikato Hospital, where I'm doing a 6-month attachment in the Henry Rongamai Bennett Centre as a psychiatric registrar, after which time I'll return to general practice in the Bay of Plenty. So why medicine? And much more importantly, why general practice? In a name? 6 times Emmy and Golden Globe Award winner, Professor Alan Alda, but for much less obvious reasons than his role as the heavy drinking, womanising prankster Dr Hawkeye that he made famous on MASH. For me, there was no eureka moment when I wanted to be a doctor. My mother was completing her postgraduate studies towards a master's degree in physical education at Otago when she met my father, who was a lecturer there. From as long as I can remember, I was going to go to Otago to study physical education. I don't know what made me change my mind and go into medicine, but my mother was a huge MASH fan. It was, however, my decision to become a GP that was much more influenced by the professor, visiting professor at the State University of New York School of Journalism, for anyone who didn't believe me. Despite a background in the arts, Mr. Alda is a keen follower of science, and for many years he hosted Scientific American Frontiers, a show where he interviewed scientists in a friendly and non-confrontational manner to help them to explain their work and convey their passion in a way that lay people could appreciate and connect with. He recognised that science is interesting and that it's important to people, but that scientists often have difficulty communicating their ideas to an audience in ways that they can understand, and this means that everyone loses out. This is a problem that in my experience isn't unique to scientists. After graduating, I moved to Mount Maunganui and worked at Tauranga Hospital. Over the next few years, I found myself increasingly drawn to the rehabilitation ward and the more practical approach to people and how we could help them live well, rather than focusing on disease and disability. Unfortunately for me, this was often countered by a sadness of a role that was often described as picking up the pieces. The most difficult patients were those who had experienced prolonged hospital admissions, often with complications, many of which were avoidable. So I headed to general practice with the hope of helping people to live well, avoid the avoidable, and where possible, the hospital. I remember those first few weeks as the hardest work I've ever done. It was more mentally and emotionally demanding than anything I had done before, but from the start it felt really good. This was in no small part due to the support I received from the long-serving GPs Max and Tony, who assumed a mentoring role to me, which still continues. From early on there, I was encouraged to explore areas of particular interest to me, which was something I'd had difficulty doing in medicine before. Sustainable healthcare. At times I feel as though the S word is used so frequently, in so many contexts, by so many people, that it seems to lose a lot of its meaning. For me, sustainable healthcare is about recognising the overlap between our individual and collective well-beings and our environment. It is based around disease prevention and health promotion, lean service delivery and minimising wastage, and using less harmful options where they are available. But most importantly for me, it's about patient education and empowerment, inspiring people to recognise the importance of their own health and its relationship to their environment. This is where I see the role of GP now and into the future, and I see effective communication as the fundamental basis of this. I think the college should be congratulated on their recognition of this and the emphasis they place on improving how we communicate in the registrar education program.